your company to help men like you get treatment for conditions that are frankly uncomfortable to discuss.
When I was about 18, I started to experience symptoms of ED and a few other symptoms, which actually triggered my dad to schedule a cardiologist appointment where I had a stress test. And then, as you mentioned, my dad was a physician, and he was specifically a physician in sexual health and sexually transmitted diseases. A few days later, I had a heart procedure. I had an ablation procedure where they basically burn the parts of your heart that are causing it to beat irregularly. And fortunately, my heart was fixed. Unfortunately, the main medication that they prescribed, the main side effect was erectile dysfunction. When the doctor first prescribed that medication, I blurred out everything that they said afterwards, even though it was about my heart. So at first, I was actually, to be completely candid, I was embarrassed by that response, right? Because my heart procedure had such a profound impact on my life, and here I was. The first thought was about intimacy. Our one-line mission, it's very simple. It's to be a patient's first call. So we needed to build a tremendous amount of trust, and so we thought that this was an opportunity to similarly provide the same function that my dad did to me personally, that one-to-one, really close, trusted relationship that solved a present pain point, but allowed us to establish a relationship that we could build on.
So talk a little bit about what kind of regulations exist for prescribing drugs online.
Yeah.
Because obviously our healthcare system is really simple and
Yes.
easy to understand.
Oh, completely, totally. We refer to it as sort of a regulatory spider web in the sense that there are so many different regulatory bodies that we have to abide by, but we actually think that that serves as a competitive advantage for the company. When we think about one of our principles is this idea of taking complexity on for our members. You know, when you look at the U.S. healthcare system right now, we have a massive provider shortage. And by 2032, we'll be short more than 100,000 PCPs or primary care providers. And so when you have a situation where there are too many people who need the service of too few providers, right? There's a mismatch there in supply and demand. And the only way to, and I'm only using this phrase, it's hopefully not as callous as it sounds, but the only way to get leverage out of a labor force is to empower them with technology, right? The only way we as a society have ever been able to do more with less is through technology. So we at Rose see this concept of providing or giving providers superpowers. Telemedicine doesn't have to mean end-to-end treatment. It can sometimes be the first point of triage. So I think that's how we think a lot about it.
Follow the data, in other words.